Lunar Medical is a company that's looking at bringing healthcare to space. And I know that may sound a little bit lofty, but the truth really is that if we can solve a medical condition in space, and we can have medical care in space, we can bring it home. So you can have care whether it's in the city or it's remotely up north, or maybe it's on an oil rig or someplace remote. We're trying to solve health problems for astronauts, and if we can solve it for that individual, we can solve it for you too.
Long confined to the realms of science, fiction, and fantasy, space travel and the potential for non-astronauts to reach space has never been closer at hand. But as we push beyond our planet, there's no shortage of question marks, including what we'll do to ensure the health and safety of those traveling beyond the reach of traditional healthcare services. Hamilton's space tech startup, Lunar Medical, was created to help address this issue. Led by president and co-founder Dr. Thomas Doyle, Lunar Medical works at the intersection of biomedical engineering and predictive analytics to bring healthcare to the world's, actually, to the universe's most remote places.
There is more attention to the initial getting into space. As you noted, the Bezos and the Virgin Galactic, we've got Musk and then this moon lander base. There's all sorts of talk about the flight, but not the human part of flight. And I think that's where we're going to see. I think we're headed into an area where the next step is, okay, we can get there, and we've proven we can get there repeatedly. How do we go beyond, or how do we support people while they're there? If you can imagine a space crew, some of them may be medically trained, but there may not be a medical doctor. And even if there was, maybe that's the person that gets injured. So how do we support people at different levels of medical knowledge or experience to help them perform, say, a medical procedure or administer medicine? But we're looking at all different types of intelligent algorithms to identify specific parameters on the body or in the environment. So we might be looking at your heart rate, we might be looking at your respiration, your activity levels, and we're looking to correlate that towards decrements in performance, health concerns, predictions for health ailments. That's really the crux of it. But in addition to the algorithms, we're looking at architectures and structures of how would we, if we were in a remote location, how would we structure these things so that they could be used by you as an individual, by a part of a team, and with a team that's also distributed. For example, if we talk about outer space or astronauts or people who are far away, the goal is really how do we better integrate humans and technology, in this case algorithms for predictive medicine, so that we can not only keep training these algorithms to be better, but also make our decisions better.
My master's focuses on trust in artificial intelligence. So I'm looking more into the robustness of artificial intelligence. So essentially, I'm looking at how the machine learning algorithms that we develop, kind of again, more maybe laboratory settings, how they might behave when we put a real world setting with the machine learning algorithm, or something like a real world change happens. So let's say this engine says you have altitude sickness or something like that. But then it comes to the question like, well, how do we know for sure? How do we trust that decision that was made by the machine learning algorithm or the AI algorithm that you implemented? So I think at Lunar Medical, the sort of idea of trust kind of arise from there. Like, yeah, we're making all these like cool algorithms, or we're thinking about how these algorithms would work, but it wouldn't be beneficial to anyone if people didn't really trust the decision that the machine learning algorithm made.
The skills required to do this are pretty substantial. I mean, we need people who are trained with an understanding of the medical side, and I'll usually call that the vehicle. And we need people who also understand the theoretical side of the artificial intelligence. And the merger of the two, there's not a lot of people that can do that. So MyTax gives me the ability to recruit really, really good graduate students and expose them to teams of medical, Canadian Space Agency, Department of National Defense, different groups who are looking at this from a medical lens, a medical perspective. And the combination of the two is quite unique. And that's what MyTax gives them the opportunity to do, is connect with the company and also allow graduate students to learn in a very unique environment. In this particular area of biomedical engineering or predictive analytics, Canada is one of the leaders in the world in this area. And given our healthcare system, we have a real opportunity to combine the expertise in AI with this medical system, medical data, and really, really make an impact.
When companies see the success of a company like Lunar Medical, which is a startup that has an office in McMaster Innovation Park, they can see what happens when you invest in experts in research. And it's the same thing where if a professor sees that there's value with partnering with companies see that as well. Projects like this really excite the sci-fi nerd in me for obvious reasons. I mean, it's a combination of precision medicine, AI, and space exploration, and I think that's exciting to everyone, especially these days where we actually do have it seems the potential to make some meaningful progress in space.
I would very much like to go to space, but I would like for my son to go to space. I would like for him to have the option to say, yeah, I'm going to go to space next week, just like a trip. And if anybody in my family or friends were to be able to do that, I would want them to have the best available medical care, whether they're on the ground or they're up there. So yeah, I would like to go, but I do think Lunar Medical has a big part to play in supporting people in the human part of human spaceflight.